I've had tons of requests for this. We're going to talk about tongue splittings today on Body Piercing Basics, episode number 129. So you might want to stick around. For those that are new to the channel, welcome to the channel. Hope you're enjoying the videos. I hope you're finding something helpful and that there's someone entertaining, I guess. But you might not know who I am. My name is DaVo. I'm a professional body piercer and have been piercing professionally since 1994. I own and operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. As I mentioned earlier, I get requested to do this video probably about once a month, twice, 3, 4 times a month. So a lot of people out there that are curious about this procedure. They've either seen a video of somebody that has it, or maybe somebody they've come in contact with and they think it looks really cool, but they're a little unsure of whether or not it's safe or not. And to be honest with you, there just really isn't a lot of information out there. This is also referred to as bifurcation or splitting or forking. That's like the 3 major terms for it. Now, this, I should give you a disclaimer. This is an extreme body modification. This goes well beyond getting tattooed, pierced, branded, even scarification. This is something where you are permanently altering a part of your body in a way that it's going to be very expensive to possibly go back to normal, or it may cause damage that can never be repaired. So you should know that going in. The other thing is, ideally this should be done by an oral or plastic surgeon, somebody who's a medical doctor who went to school, did all that stuff, and is licensed in the state or government or country that you're in at this present moment. Now, and that gets into another thing. It may or may not be legal to actually do this procedure where you're located at. For example, Illinois made it illegal that this is done by anyone other than a licensed medical professional. In the U.S., it is illegal to prescribe injectable anesthetics or even any type of medication. The only person that can do that is a doctor. If any of that's used during the procedure, it is automatically an illegal activity. Now, the Australian state of Victoria, they outlawed it on minors basically a while ago. UK, back in March of 2018, during the whole, I can't think of his name, when he was being tried for grievous bodily harm and was convicted and then did a plea guard and everything else. When the Court of Appeals came up and they talked about tongue splitting, they flat out said that it is illegal to do so if you're not someone who's a body piercing or body modification professional. If you're not licensed as a doctor, it's illegal to do that, according to the court in England and Wales. Now, other parts of the world, you need to check locally, but the reality is, in most cases, it isn't. Now, this always falls under this kind of gray zone. A lot of modern body modifications, like subdermal implants and coining of the ear or cutting the ear or elf ears, a lot of this stuff is kind of in this gray zone between whether or not it's a medical procedure and whether or not it isn't. Whether or not the person doing it is practicing medicine without a license, or whether or not they're just doing what would be equivalent to a tongue piercing or a lip piercing or what have you. It always comes down to how the person who's enforcing said laws interprets how those laws are. So a lot of times, this type of activity on the more extreme side is done underground. It is a situation where it's very difficult in most cases to really do a lot of research about the person that's actually doing it. So you have to find somebody you really trust. And the problem is how do you find somebody you really trust when you don't know anybody that's been, had anything done by them, and it's such a rare thing, and it's a bad situation that I don't know if it's going to get better or it's going to get worse. It really depends on how much of a demand there is for stuff like this. And to be honest with you, even though it gets a lot of attention on the internet and et cetera, it's really a minute part of the industry. Now let's talk about the risks that are involved. And I'm going to go into some more of those later. Main risks with this are the tissue may grow back. One of the hardest parts about healing that split is your body wants to put that all back together. So oftentimes, even though it's split, like let's say this much, well, I guess this easier example would be this. By the time the thing is fully healed, it's more like that. Your body always wants to reconnect that tissue. It does not like the idea of those two muscles being separate for a lot of reasons. This procedure can permanently damage nerves and muscles, which can impact eating, speaking, tasting, and swallowing. This could cause death of the tissue in the tongue. You can get a situation where it's cut off the blood supply or there's been such a blood loss that actually parts of your tongue will become dead and have to be amputated. Could cause excessive bleeding, as I mentioned earlier. If it isn't sutured right or for one reason or another, the sutures come loose or it just does not want to seal up properly, you could technically bleed to death. Swelling and the aftermath of this will affect and could affect long-term eating, breathing, and drinking. Infections are always a risk with any type of modification, but in this case, because you're in more contact with blood, there's a higher risk of a blood-borne or a blood systematic infection that, from the tools, the surgical tools, whatever they've used. And also there's always this increase that if you do get into that situation, that infection can move into your heart and kill you. Now, there's also the risk of damage to teeth and the structure of your mouth, gums, etc., caused by the cutting tools and etc. that the person is using. The last one is anesthesia and having an allergic reaction to it. Because if this is being done by a body modification professional, they may or may not have access to any information about your medical history and how there might be side effects or other problems caused by them injecting something like lidocaine or novocaine into your body. They have no idea if you're allergic to this stuff or not. If you don't have a history of using this in the past, you may not be aware of it. And this could create a very dangerous situation. Now let's talk a little bit about the skills that are going to be needed for this particular procedure. I don't know how to express this any more than to just flat out say, just because somebody is a fantastic piercer, experience, is great at what they do, or they're a great tattoo artist, does not mean they necessarily have the skill set to do this type of procedure. The first thing they need is some type of medical training, because this is going to involve doing things like suturing up a wound. Most average body artists, I guess, do not have that skill. It is not something we do on a regular basis. It's not something we do often. It's not something that we really need to know how to do. Of course, we're going to have some of those skills, like a working knowledge of cross-contamination prevention. They should also have an expert level of experience on the anatomy and structure of the tongue. Now, this is something that a lot of piercers may have, but maybe not to the level that is needed for this particular type of procedure. The reason being is that we tend to focus, when it comes to anatomy, on the areas that we pierce. We're not really looking at like the heart muscles and studying anatomy you would if you were going into a medical profession. We study it from a standpoint of where we are going to be inserting that needle and putting that jewelry. We don't go to the level that you're going to go if I'm going to be doing some type of minor surgery like this is, which it is. It's minor form surgery or a minor surgery. They need to have some working knowledge on using a scalpel. Now, this is not something that everybody has. They should or a cutlery tool or air gun laser. This is a very expensive piece of equipment that your average person does not have laying around the house. They should have skills with stitches, of course, as I mentioned already. Access to sterile equipment and a proper way to dispose of medical waste. They should have a clean and controlled environment in which to do this. That does not include a hotel room. Now let's talk a little bit about procedures, the methods that are used for this. First and foremost, it usually is suggested that you have a healed tongue piercing, and it really makes for like a good starting point because that tissue's already formed there, and supposedly will reduce the likelihood of the tissue growing back together. Now, I don't know if that's a fact or if that's just something that is believed one way or another, but a midline tongue piercing is a good place to start. If they're doing the scalpel version, what they're going to do is they're going to evaluate and mark off the anatomy, making sure that they are not hitting any muscle tissue. The idea is that you're going to try to avoid that muscle tissue and just go straight through. The scalpel is then heated up to cut down on the amount of bleeding you see. The idea is that you're going to be cauterizing it while you're using it. It's used to cut straight from the front to the back. Now, keep in mind, this is a lot of tissue to go through. In most cases, about 3/4 of an inch, maybe a little bit more, but it's thick, and it does take time. I've watched videos of people doing this, and it's like 10, 15 minutes of cutting and cutting and cutting and cutting. This is not something that is a simple one movement. It is a long-term thing. Once that cut is complete and both sides are separated, the inside area is then sutured or stitches are done to keep that tissue closed and to keep it from reconnecting and to stop bleeding, or at least cut down on it. The cauterized version is done with a laser. Basically, a heated beam is sent through the tongue tissue, cutting it and possibly cauterizing it at the same time, or at least that's what's supposed to happen. And then, just like the other one, sutures will need to be applied to keep that tissue separate and also to cut down the likelihood of bleeding in certain spots if noticed, where the cauterizing didn't do it completely. Now let's talk about the one that I probably get asked the most, and I had a client that actually tried doing this. The tie-off method, the DIY, do-it-yourself, at-home method of tongue splitting. Basically, what you do is you take an existing tongue piercing, put a monofilament or some other form of fishing line or line through the area, and then slowly tighten it over time, basically causing it to kind of cut through the tissue. If that sounds uncomfortable, it's because it is. It's going to limit your speech, etc., while it's going on, and it may or may not work. What may happen is your body actually just migrates the tongue piercing out to the tip of your tongue and then closes the tissue behind it. I know that it's supposed to cut from the front backwards. Sometimes it doesn't. I really am leery of this, and it should be, if you do get it done and you have a professional who's a piercer or somebody who's done it in the past or has some experience with clients doing it, I really suggest that you do it under supervision. Do not just decide you're going to do this at home. It is dangerous, and it can cause all the side effects that I talked about earlier and the ones that I'm going to go into later. The other thing is, this can take a year or so to actually happen. It is not a quick process. During that year, you're going to have your tongue binded up. You're going to talk weird. You're going to eat weird. It's not going to be comfortable. It's not going to be fun. It seems like a very extreme long-term thing to get possibly good results. Because even if everything works out well, that tissue is still going to try to seal shut. Now, additionally, you can have an allergic reaction to the monofilament line or whatever fishing line or what have you that you're using, including the dyes and the string or twine that you've decided to use. The other thing is that this can cause tissue damage that can result in your tongue getting a minor infection or a major infection. And you can use, worst comes to worst, you can lose use of your tongue. Wouldn't that be fun? So in other words, I don't really suggest the DIY version. Your best option is to go to an oral surgeon or a plastic surgeon and ask them to do it. Yes, it's going to be a lot more expensive, but it's going to be a heck of a lot safer, and they're going to have access to a lot more knowledge and tools and medications that are going to make this a lot easier and a lot less of a risk. What about the aftermath? What happens afterwards? Just like a tongue piercing, it can take anywhere from a couple weeks up to a couple months to heal. It really depends on how much damage they cause and how much trauma they cause during the procedure. This will bleed off and on, sometimes up to about a week or longer, depending on how well the stitches were done and your body's ability to clot. Because there's a great deal more damage or trauma done to the area than, say, a tongue piercing, expect swelling that's going to be more excessive and longer lasting. You will need to adjust your diet. No way around it. Soft foods, cold items, basically think tongue piercing, extended period of time. Your speech will be affected. There might be parts of certain pronunciations that you're never going to be able to do again, but it's definitely going to be affected until you get used to those two wandering muscles. Now let's talk about after the piercing's healed. What could be the long-term effects of having your tongue split? Well, first off, you're at a higher risk of mouth infections. You're at a higher risk for contracting STDs during oral sex because it's scar tissue. It's not as durable as your original tissue, and there's an increased risk of infection because of that. Next one is overproduction of saliva. If you're cutting into things and changing and altering parts of your mouth, there's a possibility that you're going to mess with some saliva ducts and you're going to start getting production of all this wetness all the time. It can affect bleeding. There's a possibility of airway blockage, a loss of taste, loss of control of your tongue, lesions on the roof of your mouth. Doesn't that sound delightful? Heavy scarring and speech impediment. Yes, you can spray and talk like Daffy Duck, but you can do this now with your tongue. So, I hope you found this informative. I hope you found this helpful, especially if you've been considering this, or maybe you're just curious and now you know. If you like this, find it helpful, found it informative, give me a thumbs up. Let me know that you liked it because we like it when you like it. If you haven't subscribed, please subscribe. Hit that notification bell so you're notified every single time we post a video. Now, if you've had this procedure done, or you know somebody who has, or you have some added information, or maybe I missed something, please leave a comment. Even if you completely disagree with me, I'd rather have that conversation in an open area where everybody knows everybody's opinions. Now, lastly, if you like swag, check out our merch store. Link is in the description. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and check out one of these other videos.